Good morning, everyone, and welcome back here to Live Now from Fox. I'm your host, Rain Augustine, moving right along with top stories this morning. Now, this subject is a very important one because many don't know that cardiovascular disease actually kills more women than all forms of cancer combined, yet only 44% of women recognize that cardiovascular disease is their greatest health risk. Now, just to throw out some statistics for you all, among females 20 years and older, nearly 45% are living with some form of cardiovascular disease. Among Black women ages 20 and older, nearly 59% have cardiovascular disease. And that's just a startling number. So let's go ahead and welcome into our show Dr. Fahmi Farah. She's a cardiologist and she's joining us with the latest information. This is a very important subject because, of course, health should be top of mind, not just during Women's History Month, but all year round. So thank you so much for joining us, Doctor. For those who don't know, what exactly is cardiovascular disease?
Thank you for having me. Cardiovascular disease encompasses a large umbrella of disease processes involving the heart and the vascular system. Of course, it includes things like heart attack, stroke, but there are a lot of other things as well. People can be born with disease in their heart. Those are called congenital diseases. There's rhythm problems where you have palpitations where you feel like your heart is going too fast. There could be structural heart disease where there's a problem with the structure. So a wide number of things that involves the heart. There are women, as you mentioned, it's a very, very important time for us to raise awareness. Basically, one woman dies in less than every minute
Wow.
in the United States from heart disease because it is the number one killer. And yet, as you mentioned, most women don't know about it.
And it looks like women of color are at a higher risk.
They are. And there are various factors involved here. One of the major factors is lack of access to good health care. And it's not just good health care, it's access to lack of access to a lot of other things as well. Healthy foods, being able to exercise, lifestyle, the coaching necessary, the information necessary, a lot of these key factors that are involved in prevention and treatment when they do have symptoms or pre-existing conditions or risk factors. So lack of access to good health care is an issue here.
One of the first things that comes to my mind when we talk about cardiovascular disease is a heart attack or a stroke. What are some of the warning signs? Because I hear that the warning signs can be a little bit different in women when compared to men.
That is correct. So first of all, the key, the classic symptoms of heart attack would be crushing chest pain. Some people describe it as an elephant sitting on their chest, profuse sweating, shortness of breath. But women, as you mentioned, can have very different symptoms. A lot of women may not have any chest pain at all. They may have nausea instead, vomiting, indigestion-like symptoms, and that's part of the reason why a lot of times it gets missed because they blow it off as something else, GI related. A lot of times, even in the emergency departments, they get missed in the first hours or first moments of the presentation. So these symptoms are very important for us to be aware of.
Very important indeed. And why does this affect men and women differently? Because again, women are at a higher risk than men.
That's right. Women are at a higher risk than men, and we do have studies that show that the disease process manifests earlier in women compared to men, especially when it comes to high blood pressure. The damaging effects of high blood pressure can start affecting women's vascular system as early as in their 20s. Why the symptoms occur differently compared to men, that we don't know yet. And that's why we need more research and more resources dedicated to women's heart disease, because as of right now, majority of the studies and the data we go by, it's actually done on men. And so we need to dedicate more of that and allocate more of that for studying women's heart disease specifically to get more answers.
And I'm sure that lifestyle can come into play. So what can we do as far as educating ourselves to make sure that we can prevent early warning signs of cardiovascular disease?
Education is key, and I'm so grateful that you are doing that right now by raising awareness. And I think when it comes to education, it really is everybody's responsibility. We need to do it at a population level, not just our providers and physicians, but for our general public. We need to have more education, more organized events where we can raise awareness. I think awareness is where it starts.
Absolutely. All right, Dr. Fahmi Farah, cardiologist, thank you so much for joining us and offering
Thank you
such
for having me.
great insight. Thank you.